between adjacent gyri is a sulcus, kind of shallow. Fissure is a deep gap. There's a fissure there.
It's a transversal.
Yep. So all this is cerebrum, cerebellum. There are two main hemispheres. There's the vermis in the middle. And let's look at posterior first.
It's a nice smell.
So in order to see the midbrain, you have to separate here without tearing it apart. So it helps if you look at something and you know what you're looking for before you start pulling it apart. So if we separate cerebrum and cerebellum, we're going to see midbrain. So we're going to see the corpora quadrigemina, those four nuclei. With a sheep, they're not the same size. Superior colliculus, huge. Inferior colliculus is kind of small. And on the sheep, it's not so much like a mound, it's more like a little miniature finger or something. Above corpora quadrigemina, we should see the pineal gland. And this one, it's hidden. So I have to kind of separate this. And all you can see really is like a little dot right there. It's just a little piece of tissue, kind of pyramid shaped, if you will. That's your pineal gland. So right there is pineal gland. Mm-hmm. So right there is your pineal gland. Some of them it's a little more apparent. So if you had a picture of the anatomy in your brain, you say, okay, I know what I'm going to see when I open that up, and then you look, you go, okay. So there's inferior colliculus down here, superior colliculus on top, and then pineal gland on top of that. Then we go ventral. 15 is pituitary gland. Pretty good size. And it covers a lot. Here's your dura mater. You can tell it's real tough, and it's the outer covering. And then adjacent to your pituitary, remember the cranial nerve I said that's huge on the sheep, and it's got 3 branches? Trigeminal. So this is trigeminal. It's coming out here. So there's one branch there, one there, one there.
Could you show it again? Sorry.
There's maxillary. No, that's mandibular, maxillary, and ophthalmic.
So that's number 14.
Number 14. And I would, on a lab test, I'd probably just do it right smack in the middle of trigeminal. Located between trigeminal nerve and your pituitary, all this stuff is just the vascular bed, all the blood flow that's going into pituitary. So all this dense material here is capillary beds. Okay. So what we have here is our olfactory bulb. And see, it's fairly wide, and then it's hard to tell by color, but on yours you'll be able to see it's going to taper down, it'll look a little darker, and then that's the olfactory tract down here. And the tract's going to be a consistent diameter. It's just those myelinated axons on the way to the olfactory cortex. So cranial nerve 1, cranial nerve 2, optic. There's the left optic nerve, and nerve comes in. Number 13 is the chiasm, so optic chiasm, there's your cross. And then 14, beyond the optic chiasm will be optic tract. So lots of little pins in a small area. But again, if you could visualize the anatomy and you drew it on a piece of paper and you go, okay, eyeball, optic nerve, optic chiasm, and then optic tract, then pretty easy to differentiate. All right, so that makes sense as far as super